What is a hip fracture? A hip fracture is a break in the upper quarter of the femur bone. The extent of the breaks depends on the forces that are involved. But what are the risks of having a hip fracture? Well, some of the most important risk factors are the age. If you are older than 60 years old, there is a high chance you might fracture your hip. Also, if you have pre-existing conditions regarding your bone strength, like osteoporosis. But that is not all. If you're a woman, I am very sorry to tell you that you might as well be a victim of a hip fracture. Obviously, having an unhealthy life also can increase the risk of having a hip fracture, so no smoking nor drinking. Now that you know what are the risks of a hip fracture, you might be asking yourself, why is a hip injury so important? Well, hip fractures are very severe, in such a way that according to the Kaiser Permanente Center of Health Research, 20% of people who sustain a hip fracture within 1 or 2 years will die. This has increased the death rate up to 4.5 times the regular death rate. As you can see, hip fractures are dangerous and happen all over the world. The measurement of how many new cases of injuries or diseases in general happen over the globe is called incidence. The incidence rate of hip fractures in Mexico is one of the biggest in the world. Women in Mexico are more propense to have a hip fracture, with 225 fractures per year, and men with 115. On the other hand, the incidence rate of hip injuries in the world is even bigger than Mexico's, within 1,371 fractures in women per year and with 629 in men. Hip fractures are very serious, and in case you have one, you should go to the doctor immediately. If you don't know if you have a hip fracture, there is a list of symptoms you need to have. Number 1. Hip pain or pain that you can feel in your knee. Number 2. Low back pain. Number 3. Inability to stand or walk. Number 4. Bruising or swelling. And finally, number 5. Foot turned out at an odd angle, making your leg look shorter. So now that you know everything about a hip fracture, what should I know and do to prevent this? Actually, there are several ways you can prevent this. First thing you should know is that the age group that is more affected are the people who are 60 years or older. So if you're younger than that, you can worry less. Second, get a correct nutrition. Always remember to eat food rich in calcium and vitamin D. Third, exercise on a daily basis. This will strengthen your bones and improve your balance. Avoid drinking or smoking. Fourth, if you are already in a point of no return, you can still prevent injuring your hip again. Just use a cane when you walk, stand up slowly, and if there are no more options, you should consider to get a hip surgery. If you really need a hip surgery, don't worry. Medical technology evolved very quickly. In fact, there are new methods for a hip surgery, such as the bone replacement. This process consists on injecting bone substitute in the patient's hip joint. Unlike the traditional hip replacement, in which the patient needs to stay in the hospital for up to 3 to 4 weeks. The bone injection method allows the patient to start walking the same day of the surgery. It also avoids risks for major infections that a traditional hip surgery might have. Thank you for listening, and remember, you can never be too cautious regarding your health. Have a nice day.